Hey everyone, it's Dr. Shim Ching here. Today I'm going to be talking to you about a very common thing that I deal with, and that's gynecomastia. Gynecomastia literally means the presence of breast tissue that is like a female breast. And because it's a condition that we find in males, the presence of a female breast in a man is something that's undesired. Men want a chest that looks like a man. They don't want a chest that looks like a female. And this is a problem that a lot of guys have, very common problem. I'm going to be going into the surgery to correct this. I'm going to be talking about why a man might have this, why it occurs. I'm going to tell you everything about this surgery so that if you're considering the surgery, listen to this video. This will give you some ideas of what to ask your surgeon and how to choose your surgeon so that you get the very best procedure. And this is the goal of the video. I want to educate people so that they know how to get the very best gynecomastia surgery possible. So I'm Dr. Shim Ching. People who've listened to my channel know me by now. I practice in Honolulu, also practice in Doha and Dubai in the Middle East. I myself have been doing plastic surgery for about 26 years now. I've performed close to about 30,000 procedures at one of the busiest practices in the United States. And after performing thousands of gynecomastia surgeries, I feel very qualified to be talking to you about this subject. So why do you have this condition? Why is it there? After seeing thousands of men for this, I can tell you that in most cases, it's really just something that men are born with. Being overweight does predispose you a bit to more fat in the chest, so that's one thing. But most of the men that I see, it's just something that they're unlucky with, and they have this fullness in their chest, and there's no real reason. People can look at hormonal imbalances, but honestly, if you have a hormonal imbalance that's causing this, then you're going to have other symptoms. You're not going to develop properly as a man. You're going to have other symptoms of the hormones being out of whack. So the vast majority of men who have this condition, it's something that we call idiopathic, or something that just exists without any particular cause or reason. Other than that, the other thing that can cause this are medications. Certain medications can cause this problem over prolonged use. And the other thing that I do see quite commonly, unfortunately, is steroid use. Steroid use can cause some degree of gynecomastia, and it's very common for me to see. Most guys who've been through steroids quite a bit, what happens is that the steroids are such a potent version of testosterone, that's why they work so well. Testosterone is a male hormone kind of responsible for male characteristics, and muscle is one of them. So when you take steroids and you work out, you build more muscle. Some of that steroid circulates in your body, and unfortunately the excess can get converted into female hormones. And those female hormones are what we believe stimulate the breast to create this gynecomastia condition. So if you've been on steroids and you have this condition, it's most likely due to the steroids, and you can blame that. Fortunately, gynecomastia is really easy to correct, so we're going to talk about that next. So what is gynecomastia, and why does either yourself or a loved one have this problem that they need to deal with? So when you look at somebody with this condition, there's going to be some fullness in the chest that looks like a breast. It can be very mild, it can just be a little bit of fullness, or it can be quite large and significant, even result in skin excess and almost something that looks more like a female breast than a male breast. So they're very varying degrees, and there are two basic things that are inside the chest that cause this. One is what we call glandular tissue. Now, glandular tissue is very similar to what women have in their breasts that produce milk. All men have this to some degree. It's usually right underneath the areola. However, in some men, more of this glandular tissue develops, and it can cause some fullness underneath the areola. In addition, there can be fat that accumulates in the chest, and that can also cause fullness. And often we're dealing with two of those things. We're dealing with both the glandular tissue that needs to be removed, and we're dealing with the fat that needs to be removed. They both need to be dealt with in different ways, which I'll explain soon. So those are the two major things that I deal with in most gynecomastia surgeries. Now, in some cases, the breast or the chest gets even larger and fuller. And if there's a significant amount, that can cause stretching of the skin, and then the skin needs to be dealt with as well. We try not to take out too much skin in the chest because that does leave significant scars in a male chest, and we don't want to do that. The whole point of the surgery is for a patient to be shirtless at the beach, at home, out and about, and not feel self-conscious about themselves. So placing a scar on the chest is something that we only do when there's a lot of loose skin and we have to do it. Most of the time, I'm just dealing with that fat and the glandular tissue. Some men just have the glandular tissue, and I'll explain that a little bit more. If gynecomastia is something that bothers you, please give us a comment down below so we can chat about it a bit more in the comments. So the majority of men that I'm treating have both things, the fat and the glandular tissue. Although some men, if they're very lean and fit, they may just have glandular tissue, which just is a small amount of swelling right underneath the areola. The treatment for that is to make an incision somewhere on the chest. Usually we try to hide it, and I'll explain that a little bit more. So we can cut that glandular tissue out. Glandular tissue is very firm and hard. We can't suck it out like liposuction, which is how we deal with the fat that's usually surrounding that area. So we need to surgically remove that. And in a select group of men that I treat, they only have that glandular tissue that needs to be removed, and can be like a small amount, like a fairly small amount that we can fit in this little circle. So that surgery is fairly straightforward. We take out all that glandular tissue, we leave an incision that's mostly hidden, at least that's what I try to do, and then we stitch things up, and then things are finished. The trick with that procedure is that you have to leave just enough. Now, the surrounding skin beside the areola, around the areola, is skin, and then there's a thickness of fat underneath. Directly underneath the areola, however, there's no fatty layer. Whenever we have a difference in the thickness of the skin or thickness in the layers of the body, there's going to be a slight depression. So a very common problem that I see is that too much of that glandular tissue is removed, all of it is removed, and then people have a caved in areola. There's this like depression in the areola and doesn't look right. It looks like it's been operated on. It doesn't have that smooth contour that we want for any part of the body. So that's the first thing I want you to be mindful of whenever you see your surgeon for this procedure. You want to talk to him and ask him, how do you know how much glandular tissue to remove? And if they're familiar with the surgery, they will go through an explanation that just enough needs to be removed so that there's no, what we call contour irregularity. There's no dip underneath the areola. It looks like it's been operated on. This is very important for any gynecomastia surgery. So in most men, I need to do that maneuver as well as liposuction in the chest, sometimes on the side of the chest, to address extra fat. Usually that glandular tissue is existing with some excess fat in the chest, and we need to remove that with liposuction. I usually do that through a small armpit incision, that way everything is hidden. But again, ask your surgeon, are they going to do just glandular removal? Are they going to do liposuction? Are they going to do both? And why? Because both things, the liposuction and glandular removal, are very important for most of my patients to do together. If you only do one or the other, then you're going to leave that glandular tissue, or you're going to leave the fat, and then you won't have the best result. So in my opinion, it's very important to ask your surgeon if you have both conditions, if you have both fat and glandular tissue, or if you just have one, and how they're going to treat it, and specifically where the incisions are and how they're going to deal with those two problems that you have, and be very specific when you ask this so that you know exactly what's going to be done. The biggest problems that I see are these things being left over or too much taken out, as I've explained before. Because if you leave one of these things behind, then you're not going to have the best result, you're not going to be happy, and then you're going to be seeing somebody like I have for revision, and somebody has to redo the surgery in a certain way to get the best result. So skipping back to a glandular excision, most surgeons will place an incision underneath the areola. I don't like to do that because I find almost always, especially if a patient's skin is a little bit darker, it's going to form a white line, a white scar, or a slightly less pigmented scar underneath the areola. In women, they often get breast augmentations that way. And as people have heard in my previous videos, I don't really like that incision with breast augmentations, and I like it even less for male chest contour and gynecomastia surgery. And the reason why is that that visible scar, and I just really feel that that's really unfortunate. I see a lot of guys for revision, they've had that incision underneath the areola, and there's not a whole lot that I can do about it other than to give them the best scar possible. Now, there are ways to hide that incision better than placing the incision underneath the areola. And that's to place the incision actually inside the areola next to the nipple. And that's what I like to do, because when that heals, for whatever reason, certain skin on the body heals better than others, you can't really see any scarring. And I like to call that scarless gynecomastia surgery because I'm hiding the scar. So a combination of a tiny armpit incision to do liposuction and a hidden scar within the areola to do the glandular removal truly does result in a scarless gynecomastia result. And that's really the way I prefer to do it. Whichever way your surgeon prefers to do it, make sure that he will offer you the most minimal scarring possible, because that's really ideal in this kind of procedure. So in summary, gynecomastia surgery is really common. It's something that is fairly easy for me to fix. I've done this thousands of times, helped a lot of men with this issue. This is probably the second most common procedure that I do in men, this and liposuction. So you can feel assured that you're not alone in this. It's something that we can fix very easily for you. Please find a qualified and experienced plastic surgeon who knows how to do this, and you're gonna have a great result. I find this a very rewarding procedure to do for guys because they feel so much more comfortable with their chest and confident with their looks, and so much more confident with themselves. So if you like this video, please give us a like down below, give us a comment, subscribe to our channel, and we'll keep making more content like this, and we'll see you next time. Thank you.